And it is true that all great nations invest in their institutions that guide and frame policy for citizens. It doesn't matter if you're in India or in Brazil or in the European Union or anywhere. You'll see many countries are measured by how they invest in their institutional policy platforms that allow good decisions to be made. And that doesn't matter if it's economic decisions, health decisions, education decisions. Good decisions are based on having the best information, processing that information in a way that leads to policies that drive the best outcomes for citizens. It's not just true of science. Governments listen to evidence, governments listen to science, but governments also have to implement policy. And there is a gap between sometimes the pure science and the actual policies that work. And that's where a government has to operate and be accountable for that translation of science into effective, affordable policy that allows a society to move forward with trust that the government is doing its best in the interest of people. No one expects governments to be perfect, and certainly no one expects politicians to be perfect, but the reality is everyone is expected to make the best effort based on the best interests of citizens, based on the best evidence. And that, in that sense, institutions that govern science and that translate science into policy and that ensure that the best possible drugs, the best possible vaccines, the best possible strategies are put in place to contain disease are extremely important. Their independence is very important because citizens must be convinced that they're giving their evidence based on the benefit and the advantage of ordinary citizens. So yes, it's really important that such institutions are independent all over the world. It's really important that governments listen to that advice, but it's also important that governments have the space to implement policy that is based on that advice, but not exclusively based on that advice at all times. And therefore, I think, yes, more and more governments, and there are many, you mentioned the US, there are many fine institutions in the United States and in other countries that have for decades and decades been world leaders in generating evidence that has benefited not only American citizens, but citizens all over the world. And we trust that those institutions will continue to perform in the way they have on behalf of US citizens and the rest of us around the world in the coming months and years.
I think Maria would like to add something.
Yeah, very briefly. Just to come to the part of your question around the challenges of science and spin and in this situation that we're in, I think, as Mike has said, many public health agencies are being challenged. WHO is challenged. But I think what we try to do, and we are an evidence-based organization, as you know, we are rooted in the science. Our role is to consolidate, to review, to reach out, to gather information from our international networks, which existed before COVID-19, but are now focused on COVID-19, looking at surveillance, looking at epidemiology, seroepidemiology, mathematical modeling, vaccine, infection prevention and control, et cetera, et cetera. What we do is we reach out to experts that are all over the world that have frontline experience dealing with this pathogen, so that that knowledge can be shared, faster than any peer-reviewed publication that can come out, any report that can be generated, so that we are constantly learning about this brand new virus that didn't exist 8 months ago. And so one of the things that we do, and you've heard us speak a lot about how we develop guidance, how guidance is developed based on evidence, based on practical experience by frontline workers, by people dealing directly with this virus, through observational studies or labs or whatever that may be, and consolidating that into practical evidence-based guidance. And I think that's our role. And that's the role of US CDC and the role of many public health agencies, is to consolidate and put that out. Now, we try to be very clear in our guidance, which is focused on reaching decision makers and reaching ministries of health and people that are taking the decisions to implement. We try very hard to make that clear and concise and readable and actionable. We sit here and we do these press conferences, we do lots of different information products, and we're surrounded in a room with many different communications colleagues and risk communications colleagues to get the information out to different audiences, because we know when we speak in scientific jargon that doesn't always translate to the individual, and to say, what does this mean for me? We don't always get it right, and we know that. We also rely on journalists, we rely on you to report the information in a balanced way and not to sensationalize it to get the headline, to not confuse the general public, and you're doing that. And we need journalists as partners to help us get that information out as well. Because as you say, there's a huge amount of information that's out there. It's too much. It's this infodemic. It's too much information, and our brains are really not meant to absorb all of that. So how can we get it out clearly to get the right information to people to know, what do you need to do? What do I need to do to protect myself, protect my family? And I think all of us have this role to play in this, whether it's the scientists or the international agencies or the national agencies. It's the journalists helping us get it out in the general public. It's all of the different information products. And we're learning, you know, we're doing this as best we can. We don't, as I said, we don't always get it right, but we are all trying to save lives. And I think with that in mind, and with the science on our side, we can continue to do that. And as science evolves, as science grows, this is a positive thing. We will continue to get that message out. And we know that you will hold us accountable to making sure that it's clear.
Thank you, Maria. We will move now to Gunilla von Hol, Swedish journalist based here in Geneva. Gunilla, can you hear me?